In the heart of our historic and yet modern Headingley campus of Leeds Beckett University, we offer a range of services to support athletes. One of those services is the cardiac screening service, which is designed to ensure safe participation in sport.
Cardiac screening is important because of the risk of sudden death during activity. We know from various longitudinal studies that screening athletes and intervening at an early stage can reduce their risk of sudden death down to almost that of the general population.
When athletes book a cardiac assessment, we send them a link which allows them access to an online form. The form covers all the legalities of handling personal information. In addition, we ask them an extensive questionnaire of personal history, medical history, cardiovascular, signs and symptoms of underlying cardiovascular conditions, but also an extensive family history questionnaire. All that information is then handed over to our medical officer, who will evaluate it at the start of the assessment. We then go on to obtain several other measurements through a physical examination, culminating in the recording of a resting ECG.
If none of those throw up any abnormalities, we can usually just sign the certificate to say that a client is fit to participate in their activity.
The athletes who are older will undergo all the same tests as the younger athletes, but in addition, we also need to check for cardiovascular disease risk, and that involves obtaining a blood sample which allows us to assess their lipid levels and their blood sugar levels, and all that additional information allows us to assess how safe it is for those athletes to continue to train and compete.